So physical activity is often emphasized for a healthy heart. So how much should individual aim for, and what are the different exercises or activities that you recommend, doctor?
Exercise is a very important aspect of heart disease prevention, because exercise is equivalent to one medicine for control of hypertension. Also, exercise also helps in regulating the blood sugar and controlling diabetes. So what are the type of exercise? The best form of exercise is moderate intensity aerobic exercise. Aerobic exercise is one that actually the heart rate goes up to a certain level and is maintained at that level. And the recommendation is that a minimum of 30 minutes of moderate intensity aerobic exercise, at least 5 times a week, is required for preventing heart disease. This is the minimum that is required. In fact, people can do more of this exercise and the benefit is likely to be higher. So aerobic exercise can be in the form of brisk walking or jogging or running or swimming or cycling. It can also be in the form of a sport such as badminton, tennis, squash, etc., depending on the individual preference and depending on the individual level of fitness. And it can also be in the form of hiking, mountain climbing, and so on and so forth.
So you've mentioned earlier that stress is a common part of a modern life. So what are the different effective ways that one can manage stress, and how does stress affect our heart health, doctor?
So chronic stress is an important factor that causes heart disease in people who are otherwise healthy. They seem to be eating normally, they seem to be eating healthy, they seem to be exercising, they don't seem to be overweight, yet they seem to have heart disease. Stress could be an important factor. Stress causes the release of certain hormones in the body called cortisol. So this cortisol has the effect of increasing the insulin resistance, is causing the blood sugar to spike, causing the blood pressure to rise, and all these finally contribute to heart disease. Therefore, stress is an important factor, not only in the causation of heart disease, but also in the aggravation and perpetuation of the risk factors for heart disease.